Thanks for tuning in to the Mothers of Boys Survival Guide podcast, where you'll hear tested advice from our experts and our mothers of boys, or as we call you, the mob, to offer insight and recommendations on raising boys. I'm Cheryl Bond, and I'm here with Susie Shaw, my good friend, TV producer, and author of Mothers of Boys Survival Guide. Hey, Suze.
Hi, Cheryl.
Well, one thing we know as moms is that you need to keep your sense of humor raising kids.
True.
And you need a really good support group surrounding you. We can be really hard on ourselves as moms, and it's important to share our stories and advice.
Cheryl, that's one of the big reasons why I wrote the book. One of the tips I share in the book is what I call the give job. And it's important to discuss with your partner whose schedule is going to change or give when there are sudden schedule disruptions like a sick child. And you can certainly count on disruptions happening.
Oh, yeah.
When my boys were ill, we were lucky enough to have one of the top docs in Baltimore as our pediatrician, and he is with us today.
Yes, joining us is Dr. Barnaby Starr. Dr. Starr has over 42 years of experience as a pediatrician in the Baltimore area, and he's recently retired. He's here to offer some practical tips to help moms navigate the magical but tiring journey of caring for their infants. So thank you so much for being here, Dr. Starr. Your name exudes confidence.
Confidence is key in this field.
So you have literally seen thousands of babies and parents throughout your career. Are there any common concerns you would hear from first-time parents that
Absolutely.
kind of across the board?
Absolutely. Almost every parent comes in with the misconception that the newborn is a blank slate immunologically on which the environment could wreak all kinds of havoc, and that they have to constantly be on the lookout because of this fragile, non-immune creature. And it really isn't true. I would say the mantra in my practice was to trust Mother Nature. And what Mother Nature does is, yes, the baby, when the baby's born, doesn't have its own immune system yet, but it's borrowing immunity from the mother. And the vast majority of immunity that the baby is born with comes through the placenta during the last trimester. So the only baby that's going to miss out on this is the very early premature baby. So if you have a baby within 4 weeks of your due date or beyond that, this baby is strengthened by the mother's memory for all the immune experience that she's had her whole life. And that passes through the placenta into the baby and then gets supplemented in the first several weeks of breastfeeding with antibodies that are in the colostrum. Even if you choose not to breastfeed, the vast majority of immunity in the baby has gotten into the baby through the placenta. So you have to trust Mother Nature. She knows what she's doing. The second most common fear that I think new parents have is that if something is going awry, how will they recognize it? Because the baby is not yet very communicative. Well, the Mother Nature's very smart, and she wants the symptoms of illness to be recognizable by all people, not just pediatricians, or only pediatricians' children can survive. So the cues of an illness in a newborn are going to be behavioral. A sudden change in the sleep-wake cycle, refusing to eat, or seeming to have trouble with their breathing. Very dramatic things that anyone would be able to recognize.
Yeah. So really paying attention to what does seem normal for that baby's behavior and noticing anything that might change.
Absolutely. The
Yeah.
cues of an illness in the neonatal period, which we should consider to be about 6 to 8 weeks, the cues are behavioral. The child is not acting the way they've been acting. That's a time to maybe pick up the phone, call the pediatrician. And I always told Susie, as I told all my patients, if you're really worrying about something, pick up the phone and call. The majority of the time, I won't be worried, and I'll be able to reassure you. And if I am worried, that's when we need to see the baby. Look at your pediatrician as your paid worrier.
Yeah.
So Dr. Starr, when we brought our
Yeah.
baby home, it was really very overwhelming. Do you have any advice for parents and moms with that transition?
Well, I think the first one is not to worry that the baby's not getting enough in the first couple of days of breastfeeding or even bottle feeding, because the babies really aren't that eager to feed early on. And Mother Nature, once again, she knows what she's doing. What's happening when you're breastfeeding is the first couple of days, it's actually colostrum, which is very rich in antibodies and not very sweet and tasty to the baby. And Mother Nature didn't want the milk in there with that because the milk would stimulate the baby to digest, thereby breaking down those immune globulins. If you're bottle feeding, you'll notice the baby takes 2 or 3 days to really get warmed up. And they tend to lose weight in those first couple of days because they're born with extra water weight to get through that early neonatal period. So I think the principal thing not to worry about is, are they not getting enough?
Yeah.
Okay. The average baby takes 2 weeks to get back to its birth weight. They all lose weight the first 3 to 5 days.
Yeah. I know. I think we tend to like just hyper focus on every aspect of everything, staring at them, not taking our eyes off of them, analyzing how much food they're getting. So uh, we like that you say you're the one to call so that we don't have to overanalyze everything.
Absolutely. I mean, it takes a lot of experience to know what to ask you on the phone to make sure I'm not worried. People would often call off and say, I think my baby's having trouble breathing. Well, what do you mean by that? Well, it's very noisy and congested. Well, how's the baby eating? Great. Well, then the
Yeah.
baby's not having trouble breathing. The
Yeah.
baby's just congested. And a simple intervention like saline saltwater nose drops might make the breathing through the nose a little easier. But again, if
Yeah.
the baby's feeding well, doesn't have a fever, and again, they can run warmer than we do too. So when you put your hand on your baby, they often feel warmer than we're used to, normal in that newborn period.
Right. Well, sleep is something that is huge and a big adjustment for new parents. Uh, do you have any advice on trying to get good sleep patterns or get into a good routine with sleep?
Absolutely, but you shouldn't have too high an expectation at the
Yeah.
beginning,
Hmm.
because in the beginning, the child is actually digesting and absorbing their own digested nutrients for the first time after birth. During the pregnancy, they've basically been on an IV drip called the placenta. So they've had continuous nutrition through the bloodstream. Now, all of a sudden, they're getting their nutrition through oral feeding. And you shouldn't expect them to sleep more than 4 hours before getting a feed in that early neonatal period.
I mean,
So
that sounds like that's just something that you don't, I, even having 4 kids, never really thought about that with food and sleeping and
yeah,
what was happening with the
well, it takes
placenta.
about
Yeah.
4 to 6 weeks for the baby to start being able to keep their blood sugar up for longer periods. And so you shouldn't have expectations that the baby should sleep through the night before that. And I really don't think it's realistic to expect the baby to consistently sleep through the night until around 3 to 4 months. Before that, you can count on them waking up at least once at night, and feed will often be all they need. And then you start to notice around 3 months that they're less aggressive and serious about feeding, and it might just be a comfort issue. And as far as really having expectations of getting continuous nights of sleep, again, I'd say 3 to 4 months. Another very important thing about the newborn in that first 6 weeks is they're learning how to handle all the stimuli of their own body. So they're very focused on organizing all these new internal stimuli that come from digesting food, that like we just talked about. And it isn't until 6 to 8 weeks that they have that constant input organized and can now focus on their outside world. And that's why 6 to 8 weeks is when you can start expecting them to really look at you and smile in response to your face, what we call the social smile. 6 to 8 weeks is realistic for that. Earlier than that, it's more their affect is related to internal stimuli.
So, Dr. Starr, one of the big concerns of new moms in breastfeeding, what is the benefits, and should there be any? Do you have advice for women who are not going to breastfeed? They're going to bottle feed.
Absolutely. First of all, no guilt. You do whatever you feel most comfortable with, because if you're doing breastfeeding when you really don't want to, it probably is not going to go very well. It takes a commitment. Can a baby turn out very healthy who is not breastfed? Absolutely. As we talked about, most of the immune transfer is actually during the pregnancy and not after birth. If you want to breastfeed, then you really got to hang in there with it for at least 2 weeks before you make a decision that you don't want to breastfeed, because it does take a week for it to start getting more warmed up and more comfortable. As far as do I have any advice on routines? I would say get the baby used to, after 5 to 10 minutes on one breast, trying on the other one. And I always found it was much better in terms of weight gain for the baby to get a smaller amount of time on 2 breasts than a large amount of time in a sleeping baby on 1 breast. As far as specifics with the bottles, again, you have a lot of input from your family usually because they have experience with bottles. And I also recommend letting the husband start doing bottle feeding quite early on so the baby gets used to feeding from both parents.
Yeah, that's a great point. Well, you touched on this a little bit, but when your baby's sick for the first time, or you're noticing things that you're attributing to thinking it's something where they could be sick, like what do you tell your parents of like when to call you? What kind of like when should they know if it's a symptom of a sickness?
Well, for example, 1 episode of vomiting in a baby that is within the first few weeks of life is extremely common, because the
Okay.
sphincter at the top of the stomach that keeps things in our tummies, that is very weak due to the hormones that circulated in the mother right
Mhm.
around the time of delivering a baby. Those hormones were meant to loosen these kind of muscles up so she could deliver the baby more easily. So the baby's sphincter at the top of its stomach is going to cause it to be very easy for them to throw up if
Mm.
sudden changes of position. So 1 episode of vomiting would not be something to call your pediatrician about. However,
Okay.
if all day long the baby is not tolerating any of their feeds, that could be a reason. What
Okay.
you look for in that kind of case is the stomach distended. Is the baby acting like they're in pain? They have a different cry from normal. Those are things we might look for. And again, like we said earlier, consistently not being interested in feeding, or once the baby's 6 weeks old, not looking at you, not noticing the environment, turning the focus inward when we should be now at 6 weeks focusing outward. Those are the
Hmm.
things you look for. Temperature wise, as we talked about, they can run a slightly higher body temperature than we do. Up to 100.5 can be normal in a newborn. So you don't want to get too crazy about constantly checking their temperature. But if you think they're breathing faster than normal and not eating well, I recommend the old fashioned rectal thermometer for an accurate body temperature. And if it's 101 or more than that, you want to consult your physician.
What about being babies that are colicky? One of my babies was really colicky, and it was difficult for everybody in the house.
Colic, true colic, is literally all throughout the day, day or night. And it's supposed to look like their stomach is bothering them. And no one fully understands what causes colic, although the current theories are that the the baby's gut is sterile when the baby's born, so that all the normal flora that inhabit our gut and help us with digestion, those take 3 or 4 months to come in and normalize. And in colic, there's a theory that a higher proportion of gas producing organisms got in there. And so they're just uncomfortable all the time until miraculously at 3 to 4 months, when the correct flora has established themselves, they go through digestion much easier. So there are all kinds of things people try. There are drops that you can try and things like that. But the bottom line is it's not a serious illness, and they do grow out of it.
How do you determine or differentiate between like a baby that's colicky and a baby that's just crying a lot?
Well, the pediatrician may want to try changing formulas or changing something in your diet if you're breastfeeding, and experimenting with things like that, because food intolerances can present like colic.
Hmm.
It's colic really is a diagnosis of eliminating
Oh, okay.
the correctable reasons.
Okay.
So, safety is always a top concern, and there's a lot of technology that's available these days to help, comfort with cameras and keeping an eye on your baby and sleep patterns. Could you just talk for a moment about the things to be like actively concerned about? Maybe SIDS or other siblings or germs when they're young. They're very young.
Yeah. Well, again, germs do get overblown because we did used to live in caves, and the babies did fine in caves. So germs tend to get overblown.
Yeah.
SIDS, especially if there's a family history, SIDS is something to worry about. But again, the back sleeping campaign has greatly reduced the incidence of SIDS, not totally eliminated it, but again, some things that are diagnosed as SIDS are actually cardiac issues. Some can be respiratory issues. Some can even be neurologic issues, and they can all sometimes mistakenly be called SIDS when really something else is going on. But I would say, again, trust Mother Nature. Um, I don't think there's any foolproof new high tech something that's going to keep moms from worrying, because it's normal to be a little
Right.
worried.
Well, I have a friend who's having her second baby. So she's trying to prepare her 2-year-old daughter for her little brother. And some days the 2-year-old is super excited about having a little brother, and then other days the 2-year-old is says no, I don't want a little brother. Is there do you have any advice on kind of how to address that emotional roller coaster with the other sibling?
Well, one of the reasons I went into pediatrics is children are honest.
Hmm.
And what that represents is true ambivalence. And
Hmm.
guess what? That older sibling is correct to be
Yeah.
ambivalent about the arrival of someone who's going to steal the stage when
Yeah.
they have really been the only one. So, reassurance that that child is still very important and will actually help teach the new child what to do and how to handle situations, and getting the older child involved right from the start, that can be a big help. But also not overreacting when the child is negative about the new sibling, and
Hmm.
trying to say it's okay that you feel that way. It's going to be a little hard. We are going
Yeah.
to have to help each other, and but that is true ambivalence.
Hmm.
That's the child that pets the new baby on the head 3 times and then clocks him.
Yeah. I
and
know.
and that's honest and normal.
Yeah.
But in terms of seeing something really bad happen, I've never seen it.
Yeah. Well, that's great advice. So, uh, so obviously, I think picking the right pediatrician is key. Uh, it's really a relationship that's so important when you have your first, second, third, you're building your family. What are some things that parents should consider when they're picking the right pediatrician for them? What are some things that they should think about?
Well, I think probably the most important single thing would be to get a sense of whether this person who's a potential pediatrician for them seems to enjoy what they're doing. Pediatrics is a field you have to go into for the right reasons. You love children, you love the experience of different ages, because general pediatrics, you deal with 0 to 18, and you want to find someone who's not just walking through routine, but really seems to enjoy what they're doing. That would be number one. Number two, in this day and age, is find out what the call system is like. When something is going on, and things tend to go on with our babies at night, who do you get on the phone when you call? Is it someone who really doesn't know your child? Is it, do they sign out to a call group that really is a separate entity from their practice? Or do you get one of 2 or 3 doctors, so over time they get to know you? I think that's probably the most critical thing. It's much easier to go into the office, have your exam. It's much scarier when something's going on at night and you get somebody who's not really part of the practice.
That's really great advice. And it was one of the things that I appreciated the most about your practice, is that it was a very small group of pediatricians that was calling us back when we need it.
And that is getting harder to find,
it
Susie,
is.
I got to tell you.
Yeah.
Medicine itself is becoming a little less personal and a little more transactional, and not really thrilled about that direction, which is why I'm enjoying my retirement.
Well, 42 years is a pretty solid amount of time in working in that field. So
Dr. Starr, we're going to ask all of our guests this question. If you had like a motto or a mantra that you would recommend for young moms, sort of like, but you've already shared this, it's my job to worry. If you're worried about something, contact the doctor. What would you say that mantra would be?
I'd say my mantra is trust Mother Nature.
Mm-hmm.
She's been doing this longer than any single expert in, whether it be nursing, hematology, any subspecialty. Mother Nature, she's been having babies successfully grow up in all kinds of environments. And I would say, trust Mother Nature.
Yep. Including the cave. Yes.
Yeah, exactly.
And in your retirement, Dr. Starr, you've written a book that I have read, and it's just fabulous. It's
that's so nice.
Can you tell us? Can you tell us a little bit about it? Because
it's about a teenage girl who confronts a lot of the problems and a lot of the issues that teenagers in our society are confronting. She comes from a very difficult emotional background in that her father died when she was young. He was her only tennis coach, and she played in a very unorthodox style where she uses both forehands, lefty and righty, and has no backhand. And I use that to help teach teenagers that if you do things in an unorthodox manner, but you're willing to put in the work, you can go very far. And she tries to become the first woman to win a major tennis tournament who plays with 2 forehands.
For those interested in Dr. Starr's book, Switch Hitter, a tennis novel, please visit the mothersofboys.life website. We'll post a link to the book and additional resources related to this podcast.
Thank you all for joining us today. Follow The Mob on Facebook, Instagram, YouTube, and your favorite podcast platform. Be kind to yourselves, moms, and have a great week. Mothers of Boys Survival Guide is a production of Flame Digital Communications and author Susie Shaw. This episode was edited by Adam Radke. Our theme music is by Rafael Fierro Valerio of Pond 5. Join the mob online at mothersofboys.life. See you next week.